Hi, this is John Burroughs, President and CEO of the Burroughs Healthcare Consulting Network, and I'm here today to talk to you about retail medicine. Well, we all know if you live in any significant community that CVS, Rite Aid, and Walgreens are all over retail medicine. There are literally thousands of retail outlets across the United States and beyond. There's actually predicted to be over 50,000 units by the year 2020. Why did retail medicine come to be, and how can you get involved? Well, retail medicine came to be because of the lack of access to healthcare. For instance, in Boston, Massachusetts, where I was originally from, the waiting time for a primary care physician was over 60 days just several years ago. And the waiting time for a specialist was 30 days. Well, I don't know about you, but if anyone in my family had a serious condition that needed attention, I would not be prepared to wait 1 or 2 months to see a doctor. So what happened was disruptive innovation. What disruptive innovation really means is that when you abandon the low end of your own industry, other new entrants come in and they're happy to take it over. The problem with new entrants is that once they get a foothold in the low end of your industry, they start to climb upstream to the high end of your industry, and that's when you really have to worry. So what happened was people with everyday ordinary problems who didn't want to go to an emergency room or even an urgent care center because they wanted something easy, convenient, and less expensive were happy when CVS, Walgreens, and CVS came on, opened their retail clinics, and now they could come and see a nurse practitioner for $49 to $69. Now, how are retail clinics managed? They're typically within another retail business. In the case of Walgreens and CVS, obviously a pharmacy. In the case of Walmart, a store, box store, or a superstore, et cetera, et cetera. You staff it with a nurse practitioner. You take care of 36 commonly encountered high volume, low risk conditions, and you have the nurse practitioners follow clinical algorithms. For instance, if I come in with a headache, worst of my life, or chest pain or abdominal pain, the nurse practitioner would immediately call 911 or ask if I would like to be transferred to an emergency department to see a bona fide physician. And by the way, they do not charge for that service. Why are they so popular? Well, first of all, they stay in their sandbox. They only take care of the things they're qualified to take care of. And most importantly, they act like a real retail business. What do I mean by that? You can make an appointment. They'll give you a buzzer like you would get in a restaurant, so you can be notified 30 minutes before your appointment. They'll give you reminders. They'll keep your records, so they give you reminders. Do you know you haven't seen a doctor or had a physical with a nurse practitioner in over 24 months? Many offices don't provide that service to you. And they're also very, very nice and cordial to you, which is not something you get every day in the emergency department. And I know, having worked there for 30 years. So it's a different business model. It's a different care model. And it's really for otherwise healthy people who want a low-cost, convenient alternative to take care of minor acute conditions. I would strongly encourage you to see if what's retail medicine can do for you and your healthcare system, because these are sweeping the industry, and we can either be part of it or we can exclude ourselves from this wonderful opportunity. Thanks very much, and I look forward to speaking with you soon.